Well, welcome everyone to this episode of Aging with Attitude. We're so glad that you're here, and I'm so tickled to be able to introduce a wonderful guest who's been on our show a number of times. Her name is Stephanie Bias, and she is the coordinator for the North Carolina Senior Medicare Patrol Program. And that's part of the Senior Health Insurance Information Program known as SHIIP in the North Carolina Department of Insurance. Stephanie, it's so good to have you again.
Thank you for inviting us to come back.
And I just have to say that over the years that I've worked with you, you just seem to be such a wealth of information, and you're so engaged in this. How did you just happen to get involved in this in the first place?
Well, I have been with the Department of Insurance for 16 years with the Seniors Health Insurance Information Program, and I've had prior experiences in the human services field and a master's in training and development from North Carolina State University. So I felt like this would be a good match for me, and it really has become a true passion, the way we see that Medicare has grown and changed, and opportunities for educating the beneficiaries. And we have 1.6 million in North Carolina Medicare beneficiaries, and I love it. It's the best thing since sliced bread, I think. SHIIP is there for everyone.
Well, I want all of you to know that after the last time she was here, I had a friend who was looking into Medicare, and she was concerned because she had heard it was a terrible or a hard, convoluted program. And I said, well, no, you just need to call this number, and you're going to share that number later on in the program. But ultimately, I need to first of all ask you, what is the North Carolina Senior Medicare Program?
The North Carolina Senior Medicare Patrol Program is housed within the Department of Insurance at SHIIP, and we are the Medicare Fraud Prevention Education arm housed within SHIIP. And our role is to educate Medicare beneficiaries about protecting their Medicare benefits from identity theft, detecting errors on their statements, and the process for reporting suspected fraud.
Can you fill us in on a little bit more about what that means?
Medicare fraud can occur in a variety of ways. You can have your Medicare number stolen from you, or you can inadvertently share it with someone that has an alternate method for wanting that Medicare number. They have actually stealing your identity because your Medicare number is also your Social Security number. So that is a huge form of identity theft. And I know that you've had folks from various organizations talking with you on the program on Aging with Attitude about identity theft and ways to protect yourself from becoming victims of identity theft. And we also talk to seniors about the process for reporting Medicare fraud, but detecting it through opening their Medicare statements, reading them and checking them for accuracy. Because you open your Duke Power bill, you open your Belk's bill, you open your Sears bill, you're not going to pay for services that were not services that you did receive. The same goes with your Medicare statements. You need to open those statements each month or each quarter when you receive them and check them for accuracy. You want to make sure that the services that were provided against your Medicare account number, which is your Social Security number, your claim number, those were the services you actually did receive. Because last year, we lost $68 billion of the taxpayers' money in this country to Medicare fraud.
68
billion.
Billion.
And, you know, you hear people say, oh, is it going to remain solvent? Is so-and-so going to take this out, or they're going to vote this out? If we continue to lose $68 billion a year, then the solvency isn't as solid as what you would like for it to be. And you want Medicare to be around. You know, we've got a big huge of baby boomers going on Medicare, and in 6 years I'll be on Medicare, so I want it to be around for when I'm there and for when my family goes on Medicare.
Well, Stephanie, holy smokes, I guess what you do then really is important. And
well, we feel that it is.
I know that just this past week we heard that, well, he was a pastor here in the Charlotte area who basically through the telephone was told that he owed more money on taxes. And for whatever reason, he had bought off on, and this was just through a telephone thing. Now, again, in your education of people, would anything come over through telephone?
Oh, sure. Oh, sure. That is, you know, with your pastor, that was probably the pastor that was talking with you about that. That may be a scam. If you feel like you owe more money on taxes, you look up a number for the North Carolina Department of Revenue or the United States IRS, and you call about that yourself to a number that you have secured from your own records or whoever prepared your taxes. Please don't fall victim to that. Many people have had their identity stolen that way, and it, you know, oftentimes is a scam, and we try to talk about that as well. Same way with Medicare. You know, people, we are in the middle right now. I know this show is going to be aired after the first of the year, but during the annual election period for Medicare prescription drug plans, which is Medicare Part D or Medicare Part C, which are the Medicare Advantage plans, that annual time to look and make a change is right now. And, you know, there will be people calling and saying, you know, I want to come to your house. I'm from Medicare and I want to explain the changes to you. But first, you need to give me your Medicare number to make sure that I'm talking with Tom Jones on Moorhead Street in Charlotte. That's a bogus thing.
That's not the way you would operate.
No, Medicare's not sending anyone to your house to sell you anything or to explain changes to you. All of the venues for education through the Department of Insurance and through the United States Congress, which pays our bill. I mean, you know, we are grant funded through CMS, which oversees the Medicare program, and mandated by Congress to have this program in all 50 states. I know we are a borderline county in Mecklenburg to Rock Hill, South Carolina. There is a SHIIP in Rock Hill and an S&P program in Rock Hill, in South Carolina as well. So, you know, we have all of that information. Folks, if they have family members that live in other states, you can go on our website at www.ncship.com, and it will tell you where the S&P and SHIIP programs are located in all of the 50 states plus 4 territories.
Just break in. Say that again for me.
www.ncship.com. Or if you want to call our office, we're going to share our new toll-free consumer line. It is 1-855-408-1212. And the good thing about that is when you call our toll-free consumer line, you'll press 1 to talk to someone about Medicare, and then you will be transferred to a live human being, a North Carolina Department of Insurance employee working for North Carolina citizens in downtown Raleigh. We're not a call center that's been farmed out in a square state or in another country. So we're there, Monday through Friday, 8 to 5, excluding state holidays.
All right. Well, we've talked about where you can get help and what the telephone numbers are. How does NCSMP, which again,
North Carolina Senior Medicare Patrol Program.
Thank you, help people?
Well, what we do is we really provide a lot of fraud education. We go out and do presentations at senior centers or at assisted living facilities or at retirement communities, to clubs and organizations, to churches. And we have a wonderful partnership in Mecklenburg County with the Central Carolina Area Agency on Aging that also takes care of all the counties that they encompass and service. We also, for the Senior Medicare Patrol Program, we really coordinate a lot with our services through Central Carolina. For SHIIP, we coordinate our services through the Tyvola Road Senior Center here in Charlotte, as well as the Shepherd's Center here in Charlotte as well. We have a wonderful core group of volunteers that help us, as well as county coordinators that are peer volunteers, people that have retired, people from other agencies that can come in and help you understand about all of your Medicare benefits and ways to prevent yourselves from becoming victims of Medicare fraud. We have a very strong working relationship with Central Carolina. We have a very strong working relationship with the Better Business Bureau of the Southern Piedmont, with their Consumer Foundation and providing educational opportunities. We have a very strong working relationship with AARP's Medicare Fraud Fighters and those folks that are located here in the Charlotte area as well. So we can't do this all alone. 1.6 million Medicare beneficiaries are a lot of folks to reach and to educate. 1.6 million in North Carolina. So, you know, Charlotte and Mecklenburg has their fair share. So we need to make sure that we get that message out of simple messaging, because I can assure you that the questions about Medicare and the confusion about Medicare are omnipresent. It doesn't matter if you are the most educated person in the world or you don't have a lot of formal education or what you did for a living or what you didn't do for a living. It doesn't matter what your status is. The playing field of Medicare is pretty equal when it comes to the confusion. So that is where we are. We're housed within the North Carolina Department of Insurance. We're not going to say go with ABC company over DEF company. We don't give your names to agents. We can't recommend that type of information because we're the regulatory authority. We can't do that. So, but we are there to help you understand about Medicare, Medicare fraud, and the ways to protect yourselves from becoming a victim.
Right. Well, again, one of the things that perked my ear, you were saying that you like to have volunteers. Would that maybe be something for our viewers? That
yes, if they are,
we
do have some caveats about what you can and cannot do to be a volunteer within the Department of Insurance. You can look on our website and see what the requirements are to become a volunteer. You can call our toll-free consumer line again at 1-855-408-1212 and ask about the possibility of becoming a Medicare fraud. We cannot, if you're a licensed insurance agent in the state of North Carolina or have immediate family members that are licensed insurance agents, that is the one caveat, because it's real hard to remain objective, when you have a licensed insurance agent in your family. But that doesn't mean that we think that there's anything wrong with those folks. It's just we have to remain neutral.
Right. Well, again, what should Medicare beneficiaries be watching out for?
Okay, when you open your statement, the one thing I want you to look for is to make sure that the services that were provided against your Medicare account number were the services that you did receive and by that particular provider. Now, I do know that, in Charlotte, Mecklenburg, we have wonderful hospital systems through CMC, through Presby, through Novant. You may be seen by a hospitalist when you go to the hospital. And you may not know what that person's name is, but just make sure that you know that you were in the hospital on those days and you did receive those services. Please have an advocate with you when you're in the hospital, a trusted family member or friend that can kind of take notes for you and become your advocate while you're temporarily down and out. You need to make sure that somebody is there asking the right questions to make sure that the services that were provided and billed to your Medicare account were the services that you did receive. You know that when you go into the hospital or you go through the emergency room, that, oftentimes in the emergency room they will say you will receive a separate bill from a different group of doctors that are staffing the emergency rooms. They may not be employees of Presby or CMC. It may be an outside source. You need to make sure that you get that physician's name that you saw or the person's name that provided your care that day. When you go to receive, let's say, lab services or x-ray services or scans, you know that you're going to get a bill or see a charge from the people that provided the scan for you and the person that read that scan. So those are charges that you're going to receive. So you need to make sure that those events that happened to you that day were the services that you did receive.
Okay. Now, how often do these summaries, I think you may have mentioned, but
They come normally once a quarter unless you sign up at mymedicare.gov to track your claims online. Oftentimes, our Medicare beneficiaries receive their statements from their secondary insurer behind Medicare before they actually receive their Medicare summary notice. So they're solving the puzzle backward, but that is something that we can help you do if you have questions about your bill and really how to make sure what makes sense on that bill, what the charges were. And if you have a Medicare Advantage product, which is a Medicare replacement product, you still have the same benefits as Medicare, but it is delivered in a different delivery system, and it may have a lower premium up front, but there is cost sharing and a limit out of your pocket. So those are the things that you need to know. Your Medicare Advantage plan, if you receive your services through a Medicare Advantage plan, whether the community-based Medicare Advantage plan or through a former employer that you worked for that offers you that as part of your retirement benefit, they are required by law to send out Medicare statements so that you can make sure, just like with your ready Medicare summary notices that you already received, which is from your original Medicare, your red, white, and blue card, you will know that the services that were provided you were the services that you actually did receive. If you see something on there that is wrong, the first thing you need to do, this is your product for appeal. And your process for appeal is you need to pick up the phone and call the provider and say, you know, I was not even in Charlotte that day. You must have me confused with someone else. Or I don't recall seeing Dr. Jaworski. I don't know who he is. I'm not familiar with him. Could you tell me, where does he practice? And does he practice at one of our local facilities where I perhaps was a patient? So those are the things you need to say. Or if you have a statement and you feel like you did receive services there, but you see other services on there that you know you clearly did not receive, you need to contact that provider. And if the provider says to you, don't worry about it, we'll take care of it, you say, thank you so much for doing that, but I'm going to also take care of it on my end as well and file an appeal with Medicare. Simple. Circle in red. It tells you on the Medicare summary notice the process for making an appeal. Call our office Monday through Friday, 8 to 5, 508-1212.
I got to turn it over.
508-1212.
Right.
Call our office. We're there to help Monday through Friday. And our services, remember, with the Department of Insurance are free and confidential.
All right. Well, we've talked a little bit about what are the important things to review. You were mentioning now again while we're airing this, or while we're going to air this episode probably in the next year, but you said that there's an open enrollment right now
for Medicare prescription drug plans. Folks need to review those plans every year because those plans can change. You may have loved that plan last year, but you may hate it next year. If you haven't done the process for review, you can call our office and give us a list of your drugs. We can run that through the system to see what plan shows up best for you for next year. Every person receives an annual notification of change in the fall of the year, telling you how the plan is going to change or if they are going to drop. We have had plans that have decided they are going to get out of that business, and so we got to get those folks enrolled in another plan so they will have coverage effective January 1. We had Medicare Advantage plans that dropped. 57,000 people in the state of North Carolina lost their Medicare Advantage plan, and they received a letter, but then they panicked and they said, they're not going to cover me anymore. Well, there are other options for you. And they said, well, why didn't they put that in their letter? Because the rules and regulations for marketing say they have to show you that they are going to drop you effective what date, and then you will receive a letter in a couple of weeks telling you what other options that you can look for. And that is something that we're helping folks do at the Department of Insurance all the time.
Wow. Well, I mean, that would be something that would scare me if I got that.
That's true, but there are other if you get that letter, you know that you're protected. There are other options available to you, but you just have a short window of opportunity in which to enact, you know, to get another kind of a plan or another Medicare Advantage plan or another prescription drug plan. So we don't want you to get lost in that shuffle. Read those statements and check them for accuracy. Make sure that it's there.
Well, again, a lot of times we wind up getting bombarded with a lot of information, advertising and so forth. How can you tell if an advertised insurance or Medicare-like product is legitimate or a scam?
Call us at the North Carolina Department of Insurance and say you've received a phone call from someone saying that they want to come to your house and explain Medicare changes for you. They may be a licensed agent, but get that person's name and phone number. And if a call center has been employed to say that, you know, they want to send an agent out there to talk to you about it, say which agent will be coming to see me, and I need his name and his telephone number, and say, you know, before I will say yes to an appointment, you can call our regulatory division within the Department of Insurance at that same toll-free consumer line and say, I need to make sure that this person is a licensed agent.
Right.
And if they come to your door and knock on the door and say, you know, I'm here in Mecklenburg County and I've got to prove to my boss that I've seen 10 people in Mecklenburg County, can you sign here and show me your Medicare card? Do not sign, do not show your Medicare card, and do not refer him to your neighbors down the street.
Right.
They need
because
to
that's not the way you operate.
That's not the way you operate, and they need to, you know, peddle their own wares and you know, create their own leads.
Well, and we're talking about what's legitimate, what's fraud. If you suspect that there is fraud, again, remind us what do we need to do?
If it sounds too good to be true, it is. Do not share that personal information. Do not sign. Do not show. If you take your Medicare card with you, please keep it face down in your wallet so no one standing behind you with a camera phone can take a picture of that card, which is also your Social Security number or the person that you're drawing your benefit from. You don't want your benefit stolen in that way. Open those statements every month. Check them. Read them for accuracy. Make sure. Keep a healthcare journal. Call our office. We can send you a healthcare journal free. And a healthcare journal is almost like your checkbook register.
Sure.
It shows when you had the test, what your results of the test are, what you want to talk to the doctor about the next time you go. Well, you can match that journal, a little mini spreadsheet in there, against your Medicare statement when it comes once a quarter to make sure that those services were the services that you did receive. Medicare prescription drug plan explanations of benefits come to you once a month. Medicare summary notices come to you once a quarter. But Part D plans or prescription drug plans, their statements come to you every single month.
Wow.
They are very detailed.
Yeah.
They show you what color the pill is. They say it is pink and green with blue writing. Make sure that matches up what's against your pill in your pill pack. You need to make sure, because remember, the services of the prescription drug plan is in the middle of the Medicare prescription drug plan is the donut hole, right?
Right.
And that means in the donut hole that you not only are going to have to pay for your drugs, you're going to pay for them out of your pocket at that time while you're still digging out from that donut hole with that gap. And if the Affordable Care Act stays as is, that by 2020 that gap will be closed, but we've got basically five more years until that occurs. You need to make sure, if you are someone who has to go to the emergency room and they say, you know, you're doing okay, but we're going to keep you overnight for observation or keep you up to 5 days for observation, you need to ask them, why are you keeping me for observation and not admitting me as an inpatient? And get an answer that satisfies you, because your payer system is different. You have to have a secondary behind Medicare or either a deep checkbook to pay out the 20%, because it no longer becomes a Part A issue, it becomes a Part B issue at that time. Also, if you know, if you have to go to a skilled nursing facility for rehabilitation, say for example you fall and break your pelvis, well, you know, you're not going to require surgery, but you're going to have some help in rehab and learning to walk. If you are admitted there under observation and not under inpatient, with original Medicare, you don't meet the 3-night requirement of original Medicare of being an inpatient before you can go to receive your services as a skilled nursing facility. Also, you need to make sure that you understand, if you're under observation status, your Medicare prescription drug plan, your Medicare Part D plan, takes care of the drugs there, not your Part A plan under original Medicare if you're an inpatient. So what that means is, the hospital is going to charge you the full cost of the drug or the hospital approved amount for the drug, and it's going to be different than you get it at your local pharmacy. So it may throw you to that donut hole a lot faster. So educate yourself. Make sure you understand. Make sure your adult children that may have to come and advocate for you temporarily while you're sick know what plan you have.
Mm-hmm. Okay, well, again, it sounds to me like this can be complicated. But it also sounds to me like you are a phone call away.
We are a phone call away at the S&P division.
Or if you're web savvy, you can get a lot of this information.
You can get information on the web, but you know, the web to me, especially with dealing with our Medicare beneficiaries, the web is a great place to find certain pertinent information, but I don't ever say just go to the web and look it up. No, if you have a question, we're going to answer that question for you. We may have to ask some information from you so we can look up information for you to make the best educated decision for you or to give you the best advice we know how. Remember, our services are free, but we want to make sure that we're not just going to say, oh, go look it up on the website. Right. Not at all.
Good. Yeah. Well, again, this notebook or handbook that you're willing to
Healthcare
send.
Journal. Have folks call.
Healthcare Journal.
We'll be glad to mail you one.
Very important for our guests to get a hold of to make their life a lot easier as they look at all of these different things.
You're exactly right.
Again, sounds to me also like, boy, you should have a good, strong advocate. Maybe be planning to have someone be working through this with you. A relative or trusted friend or something, and that kind of training for those people, you know, ultimately they can get as well, or you basically have to work through the beneficiary himself.
And I can tell you this from personal experience, living the benefit, because I'm an only daughter of 2 Medicare beneficiaries that have now passed away, but that was a blessing for me to be able to take care of them and advocate for them. But living the benefit is a little bit different than teaching the benefit. So, you really have to advocate for your loved one. Not that people are intending to provide substandard care by no stretch of the means, but you have to understand how to work this maze, and that is where we offer education. And that's where a lot of our volunteers come to us because we've helped them do something or helped their parent do something.
Right. Well, now, what is your office doing to help make the forms and other items that you're looking at easier to read?
Well, we're educating folks on how to read the forms. The forms, that form is a federal level. We're at the state level.
Right.
At the federal level, we have through input from all of us, from beneficiaries, from volunteers, from paid staff, we have told them how hard this is to read a Medicare summary notice. So it was revised last year, and our goal is to educate Medicare beneficiaries to see, it's more compliant, it's more user-friendly. It's always going to have a code on there. It's always going to have the legal description of the medical term or the service that you receive. You've got to have that because it is an insurance product. But then it is broken down into a more self-explanatory of what happens. So that's the reason. Keep that journal. That journal is critically important. Have them to call our office. We'll be glad to give them one.
And the number?
The number is 1-855-408-1212.
Well, that's wonderful and a good information for all of our viewers to understand that this is available to them. Again, we've talked about the fact that our viewers are not going to see a Medicare representative at their door.
No. Medicare doesn't hire folks to go door to door.
And again, we've talked about some of the ways that you can protect yourself from or your loved one from fraud. Have we covered all of the topics?
I think that we really have covered most of the topics today. Just know that our resources here, I'm going to reemphasize that to the folks, our resources here are through the Tyvola Road Senior Center, through the Shepherd Center, as well as the Central Lina Area Agency on Aging. Call our office. We can give you their information. Or if you're web savvy, go on our website at www.ncship.com. Ship like a boat, but with an extra I.
Well, it's been just a marvelous time to be able to share with you. You just have such a wealth of knowledge. I just want to go over a couple things to make sure that we've covered everything that we need to. I guess we basically know that we understand that SHIIP is an important part of the decision-making process when folks are preparing to turn 65 and go to Medicare.
Call us.
Call us, right. And again, for our viewers, pay attention to all the things that SHIIP has to offer, and we're so grateful to have Stephanie Bias with us this evening with all the information that she brings. We will be better citizens, and we will better be able to take care of ourselves in the future with the help of wonderful people like yourself.
Thank you so much.
Thank you.
It's been a pleasure to be with you again.
Absolutely.